We're here with Ernesto Medina. He is the founder, is it founder?
Yeah.
Of the Bay Area Health and Wellness Center here in San Jose. Are you in San Jose? Campbell.
Yeah.
So, area. And so he's going to tell us a little bit about the brain. I'll let him tell you because it's not my thing. So I'm going to step out for a minute, and he's going to go on his little spiel here. And if you have any questions, please feel free to ask them. I'll be monitoring the camera back there. And that's it. So we'll get started, and I'll let you introduce yourself and say a little bit about you.
Thank you very much. So I'm happy to be here, honored to be here. I appreciate the invitation. So yeah, hopefully we get some questions during the presentation. It'll make a little more sense once I start talking and presenting what I'm going to talk about. But a little bit about me. I run a functional medicine and neurology-based practice excuse me, in Campbell. Been there for almost 2 years now, and one of the first things I like to ask people is if they know what functional medicine is, because most of the time they don't. So I like to describe functional medicine as essentially a paradigm shift in the way healthcare providers are trained. We are trained to investigate into the root cause of chronic diseases instead of just medicating a symptom. For example, somebody goes in and they're pre-diabetic or they're diabetic. Instead of being given just a medication to control that blood sugar, we investigate into the root causes of what's causing it. So we evaluate stress levels, we evaluate your nutrition, your eating habits, your eating frequencies. We look for nutritional deficiencies that can be contributing to your diabetes or prediabetes, and we work at addressing those underlying root causes instead of just masking kind of the superficial issue. And that's true of heart disease, cardiovascular disease, high blood pressure, all the chronic diseases. That's to a degree true of. And so that's how I like to describe functional medicine. We take a very proactive approach, not a reactive approach. And it's very prevention and education based, not just prescribing something and then you're on your way. And so the subspecialty in functional neurology is those same principles applied to neurological issues. So my primary clientele that I work with in my office is a lot of women who have uncontrolled and chronic thyroid issues, especially low thyroid issues, uncontrolled diabetes, and this is specifically people who have been through the medical system or already being medically managed, and it's still not working. They're still having issues, their blood sugar is still out of control, they're still having chronic symptoms of the thyroid issue, and then they end up in our office, and those are the people we really help. And then the other passion I have is working with early onset dementia and Alzheimer's. And so you, Christine, got to attend one of our monthly Alzheimer's prevention workshops.
Yes, I did.
Yeah, I'm glad you attended.
And he does do them monthly, so if you're in the area, feel free to join in.
Yes, absolutely. And so the biggest goal I've had over the last year is to help try to educate the public on what can be done outside of the conventional medical model. Because there's a lot of research showing a lot can be done. It's just a matter of finding a healthcare provider who's trained in those things. And I should mention,
is functional medicine, really quick, is that practiced throughout the United States, or is this fairly new? Because I know there's a lot of people who haven't heard of it.
Yeah, tons of people. It's a practice across the United States, for sure. Some of the early adopters of functional medicine were actually chiropractors and acupuncturists and actually biochemists, not necessarily medical doctors. In the last probably 5-10 years, there's been a bigger push in the medical community, and so many are switching over to a more functional medicine based type of healthcare, but it's still, a lot of people still don't know much about it, for sure. And it's not easy. I mean, it's not stuff we learn in traditional school, right? It's not things we don't learn them in chiropractic or acupuncture school or medical school even. We have to train additional hours outside of school, which involves more money, more personal time learning this stuff, but it really makes a huge impact in people's lives and their health. The sad part is most medical doctors who do practice functional medicine have had a personal health crisis and realized the conventional medical model was not helping them. And it's when they explored outside that medical box that all of a sudden they found relief, or they found what they were looking for, and then ended up training and now help other people in the same way. So that's a little bit about me and my practice and what I do. So what I want to offer today to everybody tuning in is an alternative perspective, essentially the functional medicine approach and perspective to managing autoimmune diseases in general, also lupus, and to maybe provide answers people aren't getting answered in their conventional model that they're getting care under.
Mm-hmm.
So a quick side bit, the people who have dealt with thyroid issues, especially hypo or low thyroid issues, 80 to 90% of those issues are autoimmune based.
Yes, we do have a lot of lupus patients in
Yeah.
general. Autoimmune, I tell everyone, likes friends.
Yeah.
So
It does.
everybody, these things that you're talking about, there are a lot of them with
Yeah.
thyroid and diabetes and
Yeah, 100%. And I believe, so the autoimmune low thyroid condition is called Hashimoto's.
Mhm.
And I believe it is the number one most prevalent autoimmune disease in the United States, if not the world, with the amount of people that have it. I think 1 in 7 women has a low thyroid issue. And like I said, 80 to 90% of those are autoimmune based.
Yeah.
However,
and most people though don't get thyroid tested, right?
properly, correct.
Properly,
So
okay.
that's what I was going to say.
Yes.
So in the conventional medical model, the majority of people never get tested for the autoimmune component of the thyroid because the medical intervention is to do nothing.
Mhm.
It's largely ignored. So they don't test for it because there's nothing they're going to do about it anyways. And then insurance won't even pay half the time for that additional test.
Yes.
And so in a way, that's almost a hidden blessing because those patients come into our offices, we identify that they have the Hashimoto's autoimmune component, and because we don't have to fight opposing mechanisms of the medication, they get much better result using a nutritional and natural approach.
Yeah.
So in a way, it's a hidden blessing. So let's get into kind of the presentation. I entitled this presentation, Big 5 Health Secrets for Autoimmune Patients. And I called it autoimmune, not lupus specific, because we're going to get into it, but essentially all autoimmune diseases have the same basic etiology as far as how people get it.
Okay.
And we're going to expand on that in a little bit. And so before I start with my first point of the 5, I want to mention a lot of these topics I'm going to talk about are research-based. They are scientific-based. Most of the research is done by 2 specific researchers, one by the name of Datis Karazian, who's been one of my mentors, and the other one being Dr. Vojani, Vojani. So anything I talk about today, you can go to the PubMed database, research either input their names or the topics I talk about, and they'll pop up on there. All right, whether you understand it or not is another.
That's a whole different thing.
Different story. And both of them are PhD researchers who actually focus on autoimmunity and the role environmental factors and environmental triggers play into autoimmunity. And they're big in the functional medicine space as well as the functional neurology space.
Perfect.
All right, so topic number 1. I think the biggest thing people need to understand in the conventional medical system is that there is no autoimmune specialist in our healthcare system. All right, autoimmune diseases in the United States are essentially a new growing epidemic. Last time I checked, there were a little over 80 different types of autoimmune diseases, and there's new ones being identified all the time. So it's a fairly new space. So there is no autoimmune specialist in conventional medicine. The specialist you get assigned is largely dependent on what symptoms you present with, right? So lupus, for example, will fall under the category of rheumatologists, right?
Mhm.
Hashimoto's will fall under endocrinology. Autoimmunity to the brain will fall under neurology.
Mhm.
Crohn's and ulcerative colitis will fall under gastroenterology.
Nephrology
Right? Nephrology for kidneys, exactly. they are not specialists in autoimmunity. Their goal is to manage your symptoms. All right, and most of autoimmunity is still poorly understood in conventional medicine, and research is still coming out all the time, exploring these new areas. And that's why these two researchers I mentioned, they're some of the leading researchers in the field of autoimmunity and environmental factors that contribute to it. So because of that, because of the poor understanding in conventional medicine, most autoimmune diseases, and this is a generalization, but most autoimmune diseases are managed pharmacologically in the same way.
Mm-hmm.
So typically,
we're all on the same meds.
Yes, exactly. So typically it'll progress depending on the severity of your symptoms. When you get seen and diagnosed, it'll start with non-steroidal anti-inflammatories, so over-the-counter painkillers to try to manage your aches and pains, your joint pains, whatever it may be.
Tylenol or aspirin is one of the approved treatments for lupus.
Right. And when that stops working, it progresses into more powerful steroids. Mm-hmm. So things like prednisone. And then from there, when that starts to fail, it progresses into more powerful immunosuppressive or chemotherapy drugs. So those chemotherapy drugs are designed to dampen your immune system to try to inhibit the attack on your own tissues, right? Because that's what autoimmune is. Mm. It is your immune system, an imbalanced immune system attacking your own tissue. So those drugs are aimed at dampening the immune system, right? So when you dampen the immune system, if you look at the side effects on those medications, what are they? Increased risk for infection, increased risk for cancer.
And half the time those side effects are worse than the actual disease that you're dealing with.
Exactly. So then there's low motivation to continue it. And people are very, I think they get frustrated when they're deep into the system. And you were sharing your story with me, Christine. Yeah. A lot of people have massive side effects, especially after they've been on the medications for long enough, whether it be joint degeneration from long-term steroid use, weight gain from the steroid use, kidney damage from all the anti-inflammatories, liver damage, gut damage,
brain
damage, yes. And we're going to get a little bit more into the brain damage itself and how that happens. But yeah, and massive issues. So what I'm hoping to offer the viewers is a different perspective, especially if the medications are failing you. So let's see what I have here. So what happens is like you've experienced, autoimmune patients will get multiple labels, right? You'll start with one autoimmune disease and you get a diagnosis, you get another symptom, you get another diagnosis, that progresses to another autoimmune disease in your own system, you get another label, and people, when they've been in the system for a while, end up with multiple labels and the multiple diagnoses, and then multiple specialists. I had the pleasure of meeting a young lady when I was here for your wellness fair last month, and a young lady, 30 years old, walking with a cane already. She already had trouble walking, probably had motor deficits in her leg, and couldn't walk without assistance. And she got a chance to share her story with me. And she had been diagnosed with Crohn's as a toddler. I think it was between 4 and 6 years old. That Crohn's progressed to Sjogren's disease in a couple years, then progressed to scleroderma in a couple years, and then the most recent one was lupus. And so she had all these labels and all these diagnoses. But that takes us to my second point. My second point being, all autoimmune diseases have a similar etiology based on current research. Basically, they have a similar way people get the autoimmune diseases. So if we strip away those labels, in the functional medicine world, we're less concerned with diagnoses and labels. We want to get to the core of your physiology, of your biochemistry, and find out what's not working properly. When we can address that, usually through nutrition, lifestyle change, diet recommendation, when we can address the underlying physiology and biochemistry, we get a better overall health outcome. And so that's our goal. So yes, labels are good, I think in a way it gives peace of mind.
Yes,
for
I was going to
patients.
say, a diagnosis just means you're going to be okay.
Yes.
Right?
Yeah, it
Hopefully.
gives you peace of mind.
Yeah.
Because it allows you to then research into other people with those labels. You can group with people of those labels, and that's great and healthy. But from our perspective, if we want to strip away the labels, we want to get to the core foundation of what's causing the issue.
Really quick,
Yeah.
Kathleen, I see everything you're saying, and I just want to let you know he's going to talk about all the chemo stuff and that in a little bit. But just so you know, I see you. All right, go ahead.
All right. So, what essentially is the primary mechanism behind autoimmunity? And it's not an easy answer. It's very complex, but it's been narrowed down to a couple key things, which we're going to talk about. So here I have a graph. So can you make sure that shows up on the camera?
Yeah.
So that's this graph.
And then I'll show it.
Yeah.
We're filming on two things, so if you're on Instagram, right?
Yes.
So here is his little
All right.
chart right there. We really need to do this better. We're in Silicon Valley. Anyway.
So essentially, and we'll probably be able to post these in the comments.
Yes,
section.
we'll definitely do that.
A picture of these graphs. But essentially, if you look at the graph, it is in the middle we have autoimmune disease, and we have some of the leading factors surrounding it. People who get autoimmune disease, it is not a single factor, but multiple factors. And so we have to get in and isolate all of those. If I read these to you, we have genetics, we have infections and infectious diseases, we have toxic chemicals and toxic chemical exposures, we have dietary components, and then over here I drew in stress. And I'm going to expand a little bit on all of those. Okay?
Can I ask you one thing really quick?
Yes.
We have some questions. Hi, Amber. About is functional medicine covered under insurance, or is this mostly out of pocket?
It's mostly out of pocket because, like I mentioned, a lot of the diagnostic tests that we use, insurance won't pay for, unfortunately. Most of the interventions we use are nutrition and lifestyle based. Insurance doesn't necessarily like to pay for nutrition based therapies, lifestyle based therapies, and things like that. So yeah, good question. All right.
And then she says, can diet counter a lot of these issues?
Yeah, we're going to get into that.
Perfect.
Diet's going to be one of the key components that I'm going to talk about that should be addressed in every autoimmune patient. Okay, so coming back to this, causes of autoimmune disease. So I'm going to go through each one of these. So we're going to talk about infections first. So infections can be anything ranging from bacterial infections, viral infections. We have 1 trillion or more bacteria in our intestines that naturally reside there. But when we get an imbalance of that bacteria, it can wreak havoc in our system. It can leak into the bloodstream and trigger an autoimmune issue. Viral infections, things like mono, Epstein-Barr, what's the other one?
There's a lot of studies
Herpes simplex.
relating mono
Yes.
to lupus.
Mono
as well.
and Epstein-Barr as well, and
And the-
cytomegalovirus as well. All these viruses have research behind them showing that they can cause, when combined with all these other factors I talked about, in autoimmune issue. There are certain medications of the injectable kind that have live attenuated viruses in them that can trigger autoimmune issues and autoimmune flare-ups. And these are medications that are given typically to young people. And like I said, in injectable form. I won't expand more on that, but I have a graph here that we can post. This is a study out of a pharmacology journal called Vaccines, Adjuvants, and Autoimmunity. So we'll post this graph also in the comment section.
Yeah.
So you guys can see what attenuated viruses in certain medications have been linked to certain autoimmune diseases. Okay, so what we do from our perspective is we need to identify those. We do personalized blood testing to find, do you have signs of underlying viral infections? We do comprehensive stool testing to see, do you have a gut dysbiotic issue? Do you have bacterial or fungal or viral overgrowth in the gut? if we find those, we need to address them because that's one of the key components of autoimmunity. The next one being stress. So I wrote stress in here. And stress can come in the form of physical, emotional, psychological trauma, stress. Okay, those are all fall into the category of stress. And I think this is probably one of the biggest key components that isn't addressed enough
Yes, definitely.
for people personally. And that leads into, mental health as well. But, when the whole Me Too movement was going on earlier this year, that really brought to light, because I belong to a lot of forums with other doctors across the country, other functional medicine doctors, and there was a number of research articles coming out showing women especially who suffered sexual traumas, emotional traumas, abusive relationships, had a huge increased risk for autoimmune diseases. And
women in the military also.
Yeah, huge issue. And it's very sad and very unfortunate, but I think that is a big piece to the autoimmune puzzle as well. I met a woman, I consulted with a woman last year who had severe rheumatoid arthritis. And she was on high dose steroids. She had gained like 50 pounds. Her hair was falling out. She was stressed out. She described herself as like walking death. That's how she felt. The one thing she changed was she ended an abusive relationship, and within months her rheumatoid arthritis went into full remission. Within months. And her medical doctor was shocked and in tears because she was so happy for that patient. But that patient, that's how powerful these psychological stressors can be. And so she was in my office because her rheumatoid arthritis had flared up again, but she was having a stressful time at work, and she had made the decision she needed to get out of that job. And so she was 100% confident she would be able to put her RA into remission again just by changing that stressor in her life.
Yeah.
So that's how big that role is. Let's get into the next one being the chemical component. So we have listed on here toxic chemicals. Now, our world is entrenched with toxic chemicals everywhere. In the home, in the air, in the water. At the wellness fair, I met a girl named Susie from Poofy Organics.
Yeah.
So she was awesome. She was brilliant. She knows way more about environmental toxins and their relationship to diseases than I do. She would be a great guest to have on here. But we had a chance. I had a chance to pick her brain, and she knows a lot. But essentially, we have BPA in plastics, right? Everything that's made from plastic is made with BPA.
As I'm drinking from a water bottle.
Right? From a plastic water bottle. The other big one being coffee, right? We get coffee, you get a plastic lid, you put a plastic straw in it. That, especially plastic exposed to heat, that plastic melts away, gets into the drink, and you consuming that. That increases your toxic chemical exposure and risk for autoimmunity. Non-stick lining of pans. When the pan gets old, that peels off, gets into your food. Plastic Tupperware. All that contributes. So there's tons, and she could talk more about it.
Yeah, definitely.
Heavy metals is a big one, another big one. We have heavy metals like lead, mercury, things like that found in the water, especially in tap water, right? We had that big issue in Michigan, was it last year, I think, where they had humongous amounts of lead in the water causing all kinds of diseases in people there. And the piping was made from lead.
Yeah.
Right? So that's another hidden issue. So that's all I'll say about the toxic chemicals. It's a big issue, and the way we manage it is.
I was going to say, how do you avoid these when they're in your environment?
Yeah, essentially, it's impossible to avoid. Yeah. What we want to make sure is that our liver is filtering it out as efficiently as possible, and that takes us back to nutrition.
Yeah,
there are certain nutritional components, foods, and vitamins that help our liver detoxify at maximum capacity. Okay. So essentially, we're managing our body's load and getting it out as fast as we can get it in.
Okay.
Okay, and then we have the dietary components. So that's the last piece on here, the dietary components. So many people have underlying food sensitivities. I don't say food allergies, food sensitivities.
Can you tell me the difference?
Yeah. I was
For
going to get into
the people out there.
Yeah. So food allergies are typically things you get tested for by a medical allergist.
Yeah.
Right? Food allergies are usually immediate responses to a food. So you eat a food and you break out in hives, you go into anaphylactic shock, you got to go to the ER, your face swells, your lips swell, but that's immediate.
Yeah.
Food sensitivities are delayed reactions. So they can happen days or weeks after being exposed to a food. They create low-grade inflammation that builds in the system.
Does it build up as time goes on?
Especially if you keep eating it.
Okay.
As it keeps building, it can create more and more problems. All right, and we're going to get into how that, besides being inflammatory, which can add to the autoimmune insult, certain food proteins, and I'll expand on this a little bit later, food proteins can leak through the intestinal lining into the bloodstream where it's not supposed to be. The immune system will attack that food protein, but many times food proteins will mimic our own tissue. So the immune system will attack that food and our own tissue, which becomes then autoimmune.
Yeah.
Right? So foods are vitally important. Recognizing what foods you're sensitive to and are creating a low-grade inflammatory response in your system are super important, because that could be a key component of managing your autoimmunity.
And doctors normally don't test for food sensitivities, right?
No, not at all, actually. Okay. And so I get many patients who ask, well, I got a food allergy test done from my doctor. And if it's done by your medical doctor or your allergist, it's not a food sensitivity test. And it's usually worth nothing because it'll come back normal. Okay. So usually, no, they don't do it. There's specialized labs that run food sensitivity testing. I do them in my office. Most functional medicine doctors do them in their offices. Okay.
And someone just asked about your contact information. We're going to post that afterwards, so you can contact him on your own if you want to do that as well.
Absolutely. All right. So that's the dietary component. And I'm going to expand a little bit more on that as we get into the next point. So point number 2, or I should say point number 3 of the 5 is the role genetics plays. So the latest research is showing genetics plays a 1/3 of a role. Environment plays a 2/3 of the role.
Wow.
And this is from research out of the National Institute of Health. Okay? So you can look that up if you want. But if that's the case, there's nothing we can do about the 1/3 of our genetics. Right?
Yeah.
But the majority, which is the 2/3, is everything we were talking about, right?
Yeah.
The environmental factors that contribute to autoimmunity. And I get super frustrated when I consult with patients, or I look at certain forums, support group forums, and there's always the negative Nancy on there that says, it's all genetic. Just don't do anything. Eat whatever you want. Do whatever you want, because it's genetic and it's out of your hands. Or I get patients who come in who are in their 30s and 40s and pre-diabetic or have high blood pressure, and they say, oh, it's my genetics because my dad and my mom have it, and so on. And especially for the pre-diabetes and hypertension issues, I usually ask them, I say, what do you think the likelihood is that the foods your parents were eating that caused the prediabetes or high blood pressure, what do you think the chances are those are the same foods they fed you growing up, and now you're pre-diabetic and hypertensive because you were being fed the same way?
Yeah. That's
and
interesting.
I usually don't get an answer back. They usually sit there and think about it, and that's the end of that conversation. Right? And that's because 2/3, again, is environment. So a lot of that can be controlled if you know what to do.
Yeah. And even those that are genetic, you can get relief from some of your symptoms.
Yes, absolutely.
This way as
Absolutely.
well. So even if it is genetic, it's not like there's no hope.
The end all be all.
Yeah.
Correct. Yes, correct. And in the case of autoimmune patients, we know that once you get, and this is, I'm kind of skipping ahead, but we know that once you get one autoimmune disease, there's a high probability you're going to get other autoimmune diseases.
Mm-hmm.
So what if you could slow or stop that progression of new autoimmune diseases by controlling all these factors? You can, by controlling the one you have and all the risk factors associated with it, the toxic chemicals, the infections, the dietary component, and the stress component.
Yeah.
What if, right?
Yeah.
And so I like to offer hope in that sense, because we really don't know,
Mm-hmm.
but in my office we get a lot of the autoimmune thyroid cases, like I mentioned, who get tremendous relief
Mm-hmm.
by doing these steps.
Yeah.
Okay.
And we have a lot of lupus patients that do manage their lupus very well with diet.
Yeah.
So.
Absolutely. And I'll talk about a couple more resources, some books people can look up and read that say similar things.
Mm-hmm.
And so I want to show this study here, now that we're talking about the environmental component. This is a study from Autoimmunity Reviews from 2015. And this study, basically, the title, Changes in Intestinal Tight Junction Permeability Associated with Industrial Food Additives. So what this...
So layman's terms.
Layman's terms being, when there's an increase in food additives and food preservatives and food coloring in the food system, they had an exponential increase in autoimmune diseases. All right? So we'll post that study on the comments section, but out of that study came this graph. So I'll show this graph slowly here.
My high technology thing here, and I'll zoom in. I hope you can see that. Yeah.
Yeah.
So
you
that's
can see
a
the
little graph.
citation at the bottom, but I'll post the link to the actual study for you so you can look into it. But essentially, what this graph is showing is it's a net increase percentage over year. So as food additives increased in this blue graph, the incidence and prevalence of autoimmune diseases equally shot up. Okay? And if we look at the types of autoimmune diseases specifically that shot up, the majority in gray was actually neurological autoimmune diseases. Then we had gastrointestinal, and we had endocrinological, and then rheumatic, right? So neurological being a lot of these hidden underlying autoimmune issues or inflammatory issues are likely neurological based first.
And a lot of people have that brain fog.
Exactly.
That they say is lupus.
Yeah, brain fog, poor attention, even physical fatigue can often be brain fatigue presenting physically. But it goes often unaddressed. That's why we host our monthly dementia and Alzheimer's workshops, because we say in there one of the earliest signs is brain fog, brain fatigue, confusion, poor mental focus, things like that. And the conventional medical system has no diagnostic tests for that, nor answer for that. Right?
Psychiatrist is their answer.
Right? They tell you it's all in your head.
It's all in your head.
And that leads down the road of antidepressants and anti-anxiety medications, which make it worse long term. Okay? And this is really where the functional neurology specialty shines, because we have diagnostic tests that focus in that. We have assessment forms that investigate into that. And we do a very comprehensive neurological exam in our office that investigates further into that. And usually when we find cognitive issues, we find motor deficits as well. And we can use those as baseline testing. All right?
So we do have a question really quick about hormones. Like, so she's been drinking Smart coffee, and I can't see the whole comment. Like, let me see. I don't know, but can you? Sorry, Tina, I can't really see it, but I will have him look at the question afterwards. But if you have anything to say about hormones.
Yeah, hormones plays a huge role, definitely. Too much hormones and too little hormones. For women, estrogen can be a driving factor. Too much estrogen in the system is a driving factor for breast cancers and uterine cancers and ovarian cancers as well. Now, interestingly enough, many toxic chemicals, like we talked about earlier, in our environment bind to estrogen receptors. All right, so there's a big link between toxic chemicals, estrogen exposure, and estrogen dominance in the system, especially for women. So that's something we can run through and test, actually, hormone levels, either when people are premenopausal, postmenopausal, and they range, definitely.
Okay.
All right.
Okay. And we are gonna. I'll have Ernesto go through the comments later, so he can respond to you there as well in case we don't cover it.
Yeah.
In the discussion. So.
Definitely. All right. So building more on this, the role the environment plays and foods play.
Sorry, I was on, I don't know. I had it on Do Not Disturb and a call got through. But anyway, go ahead.
So if we expand a little bit further on the role food preservatives play. So in layman's terms, when we're talking about food preservatives and how the amount increased in the food system, we got increased breakdown of what's called the tight junctions of the intestinal lining, which in layman's terms they call leaky gut. So exposure to these preservatives causes an increase in breakdown of the lining of the digestive tract. Those proteins then leak into the bloodstream and irritate or flare up an autoimmune response. Mm-hmm.
Quick question.
Yeah.
Your testing, does it include testing for parasites?
Yes. Yep. Parasites is another big thing that lives in the digestive tract that can contribute to autoimmunity, inflammation in the gut, neurological inflammation, absolutely.
Okay.
Okay? And usually that's done through comprehensive stool testing.
Okay.
Okay. The last piece here I want to mention about this is this study came out of the Journal of Biochemistry. Basically, the title, Nutritional Modulation of the Intestinal Microbiota. So, the microbiome, the health of our gut and the bacteria that resides in the gut, future opportunities for the prevention and treatment of neuroimmune and neuroinflammatory diseases. So, basically, what this study investigated was the health of our microbiome, the health of our intestinal lining, the foods we put in and feed into our digestive tract play a major role in preventing autoimmunity, taming an already flared up autoimmunity, and managing its symptoms. Okay. All right. So my next point, I got 2 left. Foods, and we've already touched about this a lot, but foods have a profound effect on autoimmunity and strengthening the immune system. This study right here, so something new to the autoimmunity world and the role foods play is this concept called cross-reactivity and molecular mimicry. And so I had mentioned previously that certain foods, certain proteins of foods can leak through the intestinal lining into the bloodstream, and the immune system recognizes that as a foreign invader. The immune system then creates a response to attack and destroy that food protein. But proteins are made up of amino acid chains. And those amino acid chains can mimic other tissues within our body. It can be, in the case of rheumatoid arthritis, it can be the synovial joints or the joints in general. In the case of Hashimoto's, it can be the thyroid. And there's various neurological autoimmunities that affects the brain. And so what these researchers are trying to do, especially Dr. Vajani, is create what he calls a blueprint of breaking down what are the viral components, what are the bacterial components, what are the food proteins, what are the toxic chemicals that largely flare up specific autoimmune diseases. So this is a research paper from 1992 out of Immunology Investigations. And basically it's titled Anti-SM Autoantibodies, which is the antibody lupus, cross-reacts with dietary plant proteins. So what they investigated in this paper was essentially that they found that soybean, corn, spinach, and carrots, those amino acid chains, when you eat them, they go through the intestinal lining, they flare up that specific antibody marker for lupus. So those specific foods are a no-no for lupus patients.
Can you tell me what they are again? Can you?
In this study,
in
it's
that study,
soybean, corn, spinach, and carrot.
Okay.
And soybean, that can also be just soy preservatives, because soy is almost in everything nowadays as a preservative. So that can include that soy as well.
And people think soy is so healthy.
Yeah, they do. 98% of soy is GMO. And so the issue becomes...
Even Kathleen is shocked. She's
Yeah.
like, what?
Yeah, definitely. So those are big no-nos. Now, it can be... That's the majority. That's a generalization. That's why we do specific food sensitivity testing in our office, because it may be those foods. It may be only 2 of those 4 foods. It may be additional foods that don't fall into that category. That's why personalized food sensitivity testing is super important. All our management and treatment programs are personalized to the individual. So 2 lupus patients will not get the same treatment, right? We'll have to investigate into what their triggers are and address those triggers, and they can be totally different.
Which is perfect, because most traditional medicine doctors treat everybody the same,
Yes.
but they do teach us that every lupus patient is different.
Yeah, the irony,
So,
no?
yes, very.
So that's for lupus. Gluten and wheat is a big trigger for thyroid autoimmune patients, as well as neurological autoimmune patients. And so there's a variety. This is brand new research, and they're still trying to pinpoint create that blueprint, like I mentioned. But again, we can always do personalized food sensitivity testing in the office to pinpoint what your individual triggers are. All right?
And you can find functional medicine places everywhere.
Yes.
They just need to look for them.
They
right?
just need to look. So the biggest resource available is the Institute of Functional Medicine. So you can go to ifm.org, and right now that's kind of the leading educator of functional medicine to healthcare providers, and they have a whole provider list on there.
Perfect.
Right? I'm not listed on there because I didn't get training through that organization, but they do a lot for the profession, and so I'm a supporter of them for sure.
Great.
Okay.
Thank you.
You can also go through the International Association of Functional Neurology and Rehabilitation, for short, IAFNR.org. Right? Those are providers trained like myself who have a subspecialty in neurology, for people who are suffering from more neurological based symptoms, that we can help address and do testing in that field. Okay? So going back to the foods, to get to my last point, foods are super important. There's a lot of books that have been written regarding foods. A lot of people have heard of Dr. Terry Walls and the Walls Protocol. If nobody knows her story, she was a medical doctor who got diagnosed with multiple sclerosis. Being a medical doctor, she had access to all the latest drugs and treatments available, but within 5 years, she was essentially bound to a wheelchair. She had so much motor weakness, she could no longer sustain her body weight. She was getting to retire from clinical practice and started doing her own research outside of the conventional medical model, and found out foods and targeted supplements for the MS may give her a chance. I believe it was within 8 months of doing a drastic change, she returned to full clinical practice. She completed something like a 20-mile bike ride.
Wow.
And to this day is working and doing research on the diet that helped her. And it was essentially a paleo-based diet, avoiding processed foods and grains and dairy, things like that. So very good book, very easy read, talks more about her personal story, but she continues to do research and as an advocate for MS patients. Okay. Interestingly enough, when she wanted to speak to help educate to the MS Foundation, they denied her because they told her what she's preaching is false hope and fake. Since then, she has been invited back after the publication of the book, after the research that she is doing, and the testimonial she's getting back, right? But interestingly enough, being a medical doctor, she was a vegetarian her whole life. And she radically changed her vegetarianism to eating meat because she attributed that to nutritional deficiencies that may or may not have contributed to her autoimmunity.
Wow.
Interesting enough.
That is.
We have the autoimmune paleo diet, which is another popular one. All those are good places to start, but again, they are generalizations, right? They're for the majority of the population.
It's not tailored.
It's not tailored to the individual. So it's a good place to start. It's a good place to get educated. But again, if you've been doing it and following those programs and you're not getting the results you want, chances are you need a personalized approach. You need personalized testing to identify what your deficiencies and allergies are. Okay? I want to mention the most common inflammatory foods that exist that are big heavy hitters for autoimmunity: wheat, soy, dairy, eggs, and nightshade vegetables. Nightshade vegetables being bell peppers, tomatoes, chili peppers, so on, and eggplant, mushrooms, things like that.
What's your opinion on the keto diet? Because we have a person that says, Tracy says she does keto and she's never felt better.
Yes, so huge amount of emerging research on the ketogenic diet. In October, we had a year-end conference of the neurology organization, and doctors across the country are getting amazing results using the ketogenic diet for dementia, for Alzheimer's, for post-concussion syndromes, and for autoimmunity, especially neurological autoimmunity. There's wrong ways to do it, and there's right ways to do it. It depends on what way works for the individual. But yes, the ketogenic diet can be hugely beneficial.
Cool.
One of the biggest oppositions I get of it is that there's no long-term studies. And yes, it's so new, there are no long-term studies. The biggest long-term studies have been in seizures and managing seizures. To this day, the ketogenic diet has been more efficient than medications in managing seizures.
Oh, wow.
And that's to this day. And that was discovered back in the 1920s. Now it's being applied and reemerging again for autoimmune diseases, brain diseases, neurological autoimmunity, things like that. So yeah, definitely big. That's a therapeutic tool we use in our office when acceptable, but it is very restrictive and sometimes can be difficult for people to follow. So we try to work with what people are willing to do and slowly progress from there, slowly grow from there. That's almost all I got. The last point I already talked about is that something like 30 or 40% of autoimmune people will progress to another autoimmune disease in a certain amount of time. If you're not applying these principles, if you're just being medicated, chances are you will develop more autoimmune issues, probably more severe, which will lead to either more medications, more symptoms, more disability.
So we have a question from Angelina who is asking about supplements and are there supplements that you should take for lupus or autoimmune?
Yes, there are, but they are tailored to the individual. So that's where the personalized blood testing in our office tells us specifically what you need, right?
So a general vitamin will not work for every single patient,
no,
right?
No. And I know there's companies that will target certain diseases, and chances are, yes, you do get people better, but I would argue there's an equal number of people that don't get better from it. They're just not talked about.
Yeah.
Because it's not personalized.
Yes. Okay.
Yeah.
And you tend to only hear the good results.
Exactly.
So.
Yes.
Yeah.
Right.
Does anyone else have any other questions or comments? Anything you'd like to know? Is there anywhere, hold on, in Australia to find out more good information on lupus? Sorry, my reading, I have this little thing that interrupts some of this. They want to break down also. So as far as another country, I'm sure online resources and those sources.
Yeah.
Are those worldwide, the organizations?
I believe yes. IAFNAR is worldwide. I believe IFM is also worldwide.
Okay.
Yeah, just look in there, check it out. Or you can do a Google search for functional medicine providers in your area, and hopefully someone will pop up.
And if you're looking for lupus specific stuff, you can reach out to us. We can find information if you need it. So we're looking on a breakdown, especially for people on disability or unemployment. Like, how is that financial, Amber, or are you just like looking for a breakdown of everything in general?
Maybe I'll summarize.
Yeah, let's summarize. And
yeah.
if you have questions, keep typing them in. I'm right here.
Yeah. Before I summarize, I want to leave a couple resources for people. So I mentioned ifm.org for the Institute of Functional Medicine to find providers, or any healthcare providers who want to get trained. You can also go through IFM. iafnar.org, which is iafnr.org for functional neurology and functional medicine cross-trained providers. Silicon Valley Health Institute is an organization local here to the Bay Area, and they host monthly educational workshops with cutting-edge doctors who essentially give an hour lecture on these topics, on multiple topics, whether it be cancer, autoimmunity, dementia, Alzheimer's. And so they have a free YouTube channel. So go to the YouTube channel, Silicon Valley Health Institute. They interview just only the brightest, cutting-edge doctors on there. And they're going to talk about everything I just talked about today, if you want to further your education in that.
I do have a personal question for you.
Yeah.
Most of everybody on this site knows, or most of the lupus community knows, I do have toxic encephalopathy, which was due to methotrexate poisoning. So for me, what I'm getting now is CBT, is cognitive behavioral therapy.
Yeah.
And that's pretty much about all we're doing, except just kind of waiting to see if it progresses or waiting to see if it's stable. We're not really sure. So in those instances, because I know I'm not the only one with medication damage, are there things that you can do to, I don't know, reversing, I'm not sure. We don't know much about the brain. But are there things that you can do proactively?
Yeah. Yes, 100%. So one of the pieces I didn't mention is when we get breakdown, we have three major barrier systems that are vitally important that keep the outside environment away from our blood and our immune system. That is the leaky gut, or the intestinal lining. With leaky gut, we have a blood-brain barrier, so we can get leaky brain. And then the third one being the lung barrier. So air we breathe and getting into the bloodstream that way. Right, I've been focusing largely on the leaky gut, but equally important is the leaky brain. So research is showing as soon as you get leaky gut, you're going to immediately get leaky brain at the same time, which means all those toxins or medications or inflammatory proteins that are getting into your bloodstream are going to get to the brain unless something is done. And so there's a lot that can be done nutritionally to help support the brain, manage the inflammation in the brain. It's all going to come down to finding nutritional deficiencies for you and getting that, trying to support the neurology in that way to get it out.
Yeah.
In addition to that would be the neurological rehabilitation part, would be finding what are your deficits, right? Are they cognitive deficits? Are they motor deficits, balance deficits? Finding what those are and creating new neuronal connections, so building plasticity in those connections to improve your symptoms, right? It's a very comprehensive approach. It's both nutritional based and rehabilitation based, right? But that would be the thing to do for you. Right now, unfortunately, they're playing the wait and watch game, which is commonly done. I talk a lot about that in our dementia and Alzheimer's courses, because it's the same thing. If you're diagnosed early with dementia, they're going to tell you, well, let's watch and see what happens. When it gets bad enough,
that's when we'll start to
That's when we'll start medicating you. By then, you need 24-hour care. The person can't feed themselves anymore. They can't go to the bathroom by themselves anymore. And that time was wasted, because that time is the most important, where you can make change. You can improve the outcome. You can slow the progression. You can, in some cases, reverse its progression, right? So, unfortunately, they're doing a disservice for you right now because they're just waiting and watching. a lot needs to
And
be
a
done
lot of us patients are waiting
in that.
and
Yeah.
watching.
Yes.
Yeah.
Absolutely. And in my opinion, that's the worst possible thing that can be done. So to summarize, the two researchers I mentioned, Kharrazian, Kharrazian, and Vojdani, Vojdani. All right, you can Google them. You can put them in the PubMed, and all this research we talked about will pop up. Of my 5 topics, number 1, there's no autoimmune specialist in the conventional medical system. Most management is geared towards symptomatic relief, as long as that medication works and as long as you don't have side effects to it. Once the side effects outweigh the benefits, it changes, or when
We
the
switch
medication
meds.
stops working, you switch meds.
Yeah.
Exactly, right? Number 2, all autoimmune diseases have a similar foundation, a similar etiology. And that takes us back to this graph, in which it's a complex interaction between your physical, emotional, psychological stress, your genetics, your dietary food sensitivity components, toxic chemical exposures, and infections. Okay? Point number 3, genetics plays 1/3 of a role. The environment plays a 2/3 role. So if we can do nothing about the genetic piece, we can do a lot about the environmental piece. And that makes a huge change. And we have the area of epigenetics, which is the role environment plays in activating or turning off genes as well. So that's why I said controlling these factors can limit how many new autoimmune diseases you do get in the future. So that's the second point. The next point being foods have a profound effect on managing autoimmunity and symptom relief and strengthening the immune system. And the last piece being 30 to 40% of autoimmune cases will develop new autoimmunity to other tissue in time. Again, if nothing is done within this functional medicine model.
Cool.
All right.
Anything else from you guys out there? We did have a lot of people saying you have some great information. We had someone tuning in from Africa.
Well,
So, do you mind if I step in that you end this really quick after? I'm going to step in again really quick. So, back to me. I just want to say thank you all for joining in. We are going to put his information, those little slides are going to be there in the comments. If you have any questions, feel free to reach out to him personally. We'll put his email and his office contact. And that's about it. So I will see you next time for our next 101.